There are days I used to move in town on foot. I did not want to put on shoes.
I was suicidal.
It's only when you have been through that situation that you can know that anyone can get a mental health problem. Anyone.
You face discrimination and stigma.
We just need to sensitize people more about mental health.
People can recover, they can function, and can live a normal life.
My name is Joseph Atkunda, and I am the coordinator of Heartsounds Uganda, a mental health champion group whereby we service users come together to offer each other peer support.
Peer support is mainly aimed at tapping the unutilized resource of a lived experience of mental illness by persons who have been in touch with services, sharing their experience with those who are in crisis or recovering from crisis or coming from a recent admission from hospital.
The East London Butabika link has been working with Butabika for some time to think about how it can develop its community services, that is, provide mental health care to people who are in the community and discharged from hospital. A couple of years ago, it became clear that Heartsounds had started doing some peer support work sporadically in the community, and I knew there was this deficit. We've got 8 community recovery team members here from Butabika working in the whole of Kampala, so that's 8 mental health professionals trying to cover a population of 2 million people, so we have a real deficit of staff. And you have some very committed recovered patients who are wanting to provide some care to their fellow peers in the community. And so it made lots of sense to us who were working alongside both of these two groups that if we could bring the two together, the peer support workers would be able to offer some very good quality care to people discharged from hospital into the community.
Heartsounds is an initiative aimed at filling the gap, the vacuum of mental health care in the community. We've got a collaboration with friends in East London and a partnership with Butabika Hospital on a project called the Brain Gain Project.
There is a group that came from East London NHS, a group of service users and service providers under the program called Heartsounds. They came to Uganda, and those users from Britain told us about service user involvement, about service user leadership. And that sowed a seed in me. So I came over, came to my own premises, started Heartsounds Uganda, and when I was in the hospital, I recruited the first members, and the group started off, and it has been building itself, forging ahead, like I told you. It has been building itself up to where you see it now.
So Heartsounds really is about empathy. It's about hearing the beat of another person's heart. It's about listening to other people's lives as a way to make change and to inform change. And what I really noticed in 2005, 2006 was that service users at Butabika Hospital had huge talent and were underutilised as a resource. Nobody was asking their opinion. They were essentially voiceless. And so the Heartsounds initiative came about because it was in a way trying to bring credibility to their voice and bring a highlight to their voice so that actually it could be used to inform how mental health services develop in Uganda.
We recognize the importance of the users in the mental health service. So we work with a network of users. Wherever we have services, when the number, we have a critical number of patients, we encourage them to make a user group, which is a support group, for them to be able to advocate for their services and to support one another, peer support.
And we go out and one peer goes and visits another peer, and they talk about their experiences, they share experiences, and in the process, if one is coping very well, he gives hope to the other one that if this one can do it, then I can also do it.
I think this whole thing of mental illness started when I broke up with my ex-boyfriend. I was really drunk. I used to drink a lot. And the guy was the opposite. But you know, like love, he pampered. Not even my father would pamper a smoking daughter. No, my mom. But he pampered me all the years we were through, and after some time I understood I was breaking him, you understand? And I told him, we can quit the stuff because I can say I'm breaking you. And I used to say it jokingly, but then it did go on and we broke up. And then I realized no one will welcome a smoker. No one will welcome an alcoholic. This guy could be special in some way, but I had said bye to my past now. That's when it started. I hated everything. I just wanted to be alone. Try to love myself, and that's when I got this voice I have.
Now, one of the things which intermingle is alcoholism and mental illness. Usually when I'm taken to hospital by police, when I've done something upheaval, and I'm usually drunk. And in fact, in the hospital they write alcohol-induced psychosis. But when I'm not manic, I don't like drinking. So, me, I call it psychosis-induced alcoholism, because when I'm manic, that is when I want to drink. Then I cause upheaval. Now, when you add the two, the mental illness and the drink, it is terrible.
But now I think I've overcome the problem. It's been 3 years down the road now, but I think I've come past it now. But it has not been easy. It has not been very easy. You like to go to mom, but you don't want her to know you smoke marijuana. You want to go to daddy, he will kill if he discovers you drink and you are born a Muslim. So I closed and I said to myself with my light, it's not easy to stop smoking today when you smoke for years. Yeah, but I think I haven't smoked today because I don't sell cigarette now. This is not my shop, this is my mom's shop. When the shop was first given to me, there was cigarette, there was alcohol, and I had party here. Trying to shake off the heartbreak, and you know, guys here from morning drink and you enjoy the group. And then I realized at one point my life wasn't going where I thought I wanted it to go. I had to remove the alcohol, I had to remove the cigarette from the shop. Now I hardly make any money, but I'm comfortable knowing at least I'm not in an environment of people who drink. When they sit there, I sit in there and make a bracelet or read a book.
Elizabeth is really recovering. Now, as you can see, with a bit of encouragement from some of us, plus her own reflection in her head and what, has decided to stop drinking. And that is something that will really lead her to serious, steady recovery.
It is at Heartsounds I first found comments of, wow, you're brilliant. Wow, you can do this. Those comments first came from Heartsounds. With my family, well, you can do good things, you can do bad things, but they are always ready to criticize the bad. And you live life knowing you can never do anything good.
As we share experiences with Elizabeth, we give each other moral support, because as you know, there is a lot of stigma in mental illness. So we sort of give each other company. There is a lot of discrimination. But when I come and talk to her on an equal to equal basis and we share jokes and we laugh, then she feels a bit okay. Even if I can't come all the time, but for that small time I've come, she feels a bit okay.
Thank you. Hello, how are you? You okay? How's it going? What are you doing today?
It's only when you have been through that situation that you can know that anyone can get a mental health problem. Anyone. Anyone. Especially I don't confide in someone.
Okay.
Thank
you.
When I was young, I used to see Valalu and I was like, what did they do? You know, perhaps people have said, yeah, don't mind him, he robbed someone, so they bewitched him and all that mystery. At the end of the day, he's a human being whose mind is a bit disoriented and he needs to be taken care of.
The first time I met Daniel was at the National Theatre in the film club. And usually we had a discussion after the film club. And Daniel put up his hand and said, really, I have had this challenge of mental illness, but I've never gone public about it. As a teacher, I would feel shy to let my students know that I have a mental health challenge.
I think part of recovery is from the heart. And I realize that without support, you cannot recover. So, because of that, I understand the importance of support. And when it comes to peer support, you're helping someone who is through that experience, you share experience.
The good thing with Daniel is that he's open. When he's about to get sick, you can know because there is a way he changes. And with sickness, I think one has to be open to people so that they get to know about your health, and because you can't be helped when you're not open. But Daniel is open.
I think Daniel he's got good days, glorious days ahead of him. He's a success story, if I may say, because this is a person who has had a downfall. He had gone to school, pursued his studies, managed to qualify as a teacher, but because of the challenge of the mental illness and the stigma associated with it, that venture of pursuing teaching was not fulfilled. But he didn't lose hope. He fell down but stood, dusted his shoes and moved on to work into the community with children, and now with the peer support work in the community with Heartsounds. So he's not a loser, he's somebody who gets back on his feet once he falls down.
For now, I'm happy that he's engaged in community work. He's doing something that he's already interested in, so he does not need anyone to drive him to that career. So I feel happy when he's doing something that he's so much interested in.
So these user groups have been very useful in ensuring that the people go back to being functional. They are being able to take care of their own destiny, to work and earn and contribute to the community, and also be able to take care of their own health. So it is very important to have these user groups. We cannot do without them.
And I think there has been initially some resistance about the idea that peer support workers might not be too disorganised to do this sort of work. So that affected the planning of this programme. Initially, the peer support workers were going to be working in the hospital, but I think people were not, staff were not sure that peer support workers were ready to do that. And so we decided to focus initially in the community where there's this real deficit of care. What we have found is that very quickly the staff from the hospital are seeing the benefits of this, and within 6 months we were already getting calls from the in-charges on the wards saying, please can we have peer support workers coming onto the wards. Just in the meeting today, we heard a call for peer support workers to run groups on all of the wards to offer care there. And so I think the way that you convince people of the effectiveness of this model is to actually do it so that people can see with their own eyes. We are evaluating it, so we hope we have a good, some good information to support it, but people are seeing the differences for their own eyes, and that's been the most powerful way that we have got those people who are somewhat cautious about this approach on board.
Peer support work in Uganda has been really groundbreaking, and they are a hugely talented group who are providing a new service. It's a perfect fit for a poor resource setting, in that you've got a group of people who need opportunities, who have talent and who have experience and expertise, and you include them in the formal provision of service, and everybody wins. Everybody wins, and actually the service they're providing is high quality, and actually it's really needed for people to have hope and to stand as role models in communities for being able to get through mental health problems, not only just to survive them, but actually to blossom out of them as well. These are really inspiring people, so the future is very bright for Heartsounds Uganda.